Can you fix bunions without surgery and still run? Short answer, yes. You can absolutely reduce pain, improve your mobility, and keep running strong even with bunions, even if you have a family history of bunions. You do not have to give up your training or sign up for surgery right away if you start developing bunions, especially if you're a runner over 35, just trying to stay healthy and active. In this video, I'm going to walk you through exactly how I help runners reduce bunion pain naturally and avoid surgery and stay on the road running pain-free. The key is pain-free. Hey there, I'm Dr. Abby Siler, a physical therapist who helps runners over 35 recover from injuries and run pain-free for life. And bunions, they are one of the most misunderstood and mistreated issues that I see. A lot of people are told immediately that they need surgery or that they should stop running altogether because of the bunions. But for most runners, there's a lot that we can do first to make sure that the bunions don't get worse, or that you can keep running without much pain and not have to have a costly or any type of surgery that gets you out of running for a long time. So a bunion is basically a structural shift at the big toe joint. Yes, the bump is real, but the pain is often made worse by poor mechanics, tight footwear, and weak feet. Footwear being really the key here. So what does bunion relief without surgery actually look like for a runner, especially those of us that are over 35, have a history of bunions in our family, we have our moms or grandmas had it. Here are the 5 steps that I use with all of my clients. Number 1, wider toe box shoes. Most running shoes and most modern shoes in general compress the forefoot, which makes bunions worse. They make our toes point in that shape that bunions form. And so if you choose a shoe with a wide toe box to give the joint more room to run, or more room to move, not run, then you're able to spread your toes out a little bit and help decrease that pain and discomfort that you're getting from the toe moving in. Number 2, use toe spacers. Mine are MIA. My 7-year-old took them from me. But the reason that I like these are they help really realign the toes and activate and stretch the small foot muscles that often get squished and shut down when the foot is compressed in our shoes. So it helps us take away from that daily pinch toe aspect and really stress them out. I'll link my favorite pair though in the description. I need to get a new pair. I love them. Wear them at home for 10 to 15 minutes a day. Wear them while standing, while strength training, or just around the house. Wear them longer and longer to offset what your feet are in during the day. Number 3 is we need to strengthen the intrinsic foot muscles. These are those little muscles in your feet that are inside of your feet. So they're the intrinsic muscles. They move the foot intrinsically. We need to get them moving and strengthened so that they can do their job again. So we're going to try short foot exercises, towel scrunches, toe yoga. It doesn't have to be complicated, but it does need to be consistent. I'll link my video that I made on some great exercises that are just good exercises and mobility for the feet in general, but they're also great for bunions. So be sure to check that out if you want a full exercise routine that you can do daily. Number 4 is we want to mobilize the big toe joint. Sometimes the joint gets stiff and restricted. Gentle mobility drills like big toe glides and moving in a circular motion. So you're just taking your big toe and going around. You're helping move it around. It can help restore range of motion and really reduce the pressure that you're feeling when you're running. 5th way of helping out with bunions is improve your gait mechanics. If your stride is off, even just a little bit, it can overload the big toe. That means we need to strengthen our glutes, control our cadence, and really work on our push-off mechanics in our calves and help keep things strong so our big toe isn't taking more of the pressure than it needs. This is often the piece that runners tend to skip, and it really does make all the difference in the world. I'll add a video later on some good exercises to help with these runner mechanics and help improve push-off. So if you want to try a few of the tools that really help, here are my go-tos. Toe spacers for good muscle stretching and realignment. Some Superfeet insoles. Insoles can help short term for some temporary support that doesn't overcorrect, but we want to get out of them fairly soon because we want to get our feet moving the way they're supposed to. Wide toe box running shoes like the Ultras, Zero shoes, those are some of the common wide toe box shoes. Think about when you search for shoes, if you're looking for anything else in Ultra, search for natural toe shape or natural foot shape shoes, things like that, wide toe box. That's where you're going to find the right ones for your feet when you're dealing with bunions. And they're just great shoes to be able to let your toes really spread out and move better when you're running overall, whether you have bunions or not. So if you're dealing with bunion pain and feel like you've tried everything, please don't give up. Surgery might be necessary in some cases. I don't want to say that it's not necessary, and everyone's case is different, but a lot of runners over 35 and runners in general can see huge relief by just simply changing their strategy, working on the feet muscles, working on our movements, working on our strength, and not quit running. If you want to do that, if you want help doing that, check out my 12-week foot and ankle recovery program. It's a done-for-you program that you can follow along on your own speed. You'll have it for life. It's built specifically for runners over 35 who want to fix foot and ankle pain and build real strength for life so they can run for life. The link for the program is down in my description. Or we also, if you need some more help, I also offer one-on-one rehab coaching, and you can work with me directly and have weekly check-ins and coaching to help you really get back to running pain-free. So tell me, have you been told previously that you need surgery for your bunion, or are you currently running through the pain of having a bunion and just hoping on a wish and a dream that'll go away? Drop me a comment and let me know where you're at. I'd love to hear your story and see how I can help out. Next time, we're going to keep answering foot and ankle questions, so make sure to stay tuned. Make sure you subscribe, like that video, sign up for notifications. That way you're always aware of when I put something new out that's going to help you run for the rest of your life.